I'm Dr. Charles Ruotolo, and today I'm going to be talking about adhesive capsulitis or frozen shoulder. Adhesive capsulitis is a problem that occurs in someone's shoulder joint that occurs for some unknown reason. The shoulder capsule becomes inflamed, and this comes in 4 phases. It's more common in females and it's more common in middle age, though males certainly can get this, and the group that it's most common in is people with diabetes. That said, if you get adhesive capsulitis, it doesn't mean that you also have diabetes. Adhesive capsulitis has 4 phases. The first phase is an inflammatory phase where, for some unknown reason, your joint capsule becomes inflamed and it becomes painful. This phase usually lasts for 1 to 2 weeks. From there, you quickly go into phase 2, which is a phase where your shoulder capsule is also starting to shrink and contract from that inflammation. It's in this phase 2 that you realize that your shoulder is becoming frozen, and if someone comes to their doctor early on in phase 1, you might be diagnosed with tendinitis or you might be diagnosed with bursitis because you're not stiff at all. But it's very easy to realize someone who's in phase 2, because in that phase it's not just pain, it's also there's a large lack of motion in the shoulder. Phase 2 lasts for about 4 to 6 months, from which time the inflammation finally starts to calm down and you go into phase 3. The difference between phase 2 and phase 3 is phase 2, your shoulder hurts all the time. There's usually an ache here on the side of the shoulder. Sometimes you also get some pain along your scapular muscles too, because your scapula is moving twice as much because your shoulder's stiff. But phase 3, that pain has calmed down a lot and you're no longer in constant pain. In phase 3, you just have pain when you move your arm to different positions where it doesn't want to move. It's also in phase 3 where patients start to see gains in their motion, where usually in phase 2 there aren't gains in motion. And then phase 4 is whatever you're left with, though most patients get everything back. But if you're diabetic, sometimes you don't get all that motion back, or if you have a severe case of adhesive capsulitis, sometimes you have some loss of motion at the very end of all this. There are several treatments that you can do for adhesive capsulitis. The mainstay of treatment is stretching. There is a stretching program that you should do 5 times a day, 1 minute at a time. And so this is something that short bursts of stretching throughout the day helps to get that motion. Usually patients, when they first start this, have more pain. They have to be patient with this and understand that usually when you first start stretching, especially when you're in phase 2, on a shoulder that's already painful, that there is some more pain in the very beginning, and usually only significant gains in your motion occurs when you're in phase 3. Besides that, you can do some formal physical therapy, and this helps because you're working with a therapist who also keeps you on track with your stretching, which you'll be doing every day. Another treatment for this is a corticosteroid injection, and it has been shown that a corticosteroid injection in the shoulder joint can help turn off this inflammation, and is one of the few cases where a corticosteroid injection can make a permanent change in your shoulder, in the sense that it turns off that inflammation and can push you from phase 2 into phase 3. That works much better early on in phase 2, so patients shouldn't wait. If they're diagnosed with adhesive capsulitis and they can get a corticosteroid injection, that they don't have diabetes where the blood sugars are out of control, a corticosteroid injection can really help a lot. And there's been a recent study that shows that 3 corticosteroid injections were as comparable to doing physical therapy for this problem. For patients who don't see any gains in their motion and who are in phase 3, and they have 3 straight months where they are stretching but they don't see any improvement in their motion, that's an indication for surgery. It is an uncommon problem though, because most patients, when they're in phase 3, will see gains in their motion. But for patients who've made it to phase 3 and are not getting any gains, an arthroscopic capsular release can be something that is performed that helps to restore their motion. That is a procedure where you make a small incision in the back of their shoulder, a small incision in front of their shoulder, and you cut that tight capsule going all the way around in their shoulder joint. So for adhesive capsulitis, there are 4 stretches that we're going to be doing. Each of these stretches you're going to do for 2 sets of 20 seconds. The first one is just by grabbing up. It's for forward elevation. You're going to put your hand up on something, and the key with this is your fingers are over the top of something. It's not just climbing up the wall. You want to generate a lot of force with this stretch, and whatever it is, if you're tall, sometimes you can reach up to the top of a door. If you're a little shorter, just find something where you can put your hand on top of, and then from there, she's just going to relax some and do a controlled stretch where she gets to the point where she feels like she's significantly stretching her shoulder, but not so much that she's killing herself. And she'll hold this for 20 seconds, pause, and then repeat. So for the neck stretch, this is done on a door frame. This is for abduction, external rotation. In adhesive capsulitis, these patients have significant loss of shoulder extension. They can't bring their arm out like this. And so to start the stretch, you're going to step over here so you're facing the door frame. Her arm is going to be parallel to the floor. Her forearm is going to be along the door frame. And then from here, she's going to turn her shoulders this way. She's going to feel discomfort in the front of her shoulder, and that's, you know, the stretch that's what you want to be stretching. She's going to hold this for 20 seconds, relax, and then repeat it. So it's 2 sets of 20 seconds. The next stretch is for external rotation at the side. She's going to be working on this. And the key with this is not to bring your arm away from your body. I think when you first start doing this, the key here is to take a piece of paper, put it in here, hold on to it, and that way you're keeping your elbow on your side. Again, at this point, her forearm is going to be parallel to the floor. She's going to be facing the door frame. She holds on here. She keeps her wrist straight. And then she's going to turn her body like that. And again, she's going to feel discomfort in the front of her shoulder. That's, you know, stretching the front of the shoulder. She's going to hold this for 20 seconds, and she's going to do 2 sets of 20 seconds. That's good. So this next stretch is for your posterior capsule. This stretch is the last stretch I introduce to patients because, you know, patients with adhesive capsulitis, the first thing they're going to get is they're going to get their forward elevation. From there, they're going to get their abduction, external rotation, but their internal rotation, the ability to reach behind their back, is usually the last thing that they get. So in the beginning, I don't have patients waste time doing this stretch because I don't think they get much benefit out of it. But as their shoulder starts to loosen up and as they get more forward elevation, I'll introduce this stretch. This is called a sleeper stretch. They're going to be laying on their shoulder blade, so when they stretch, their shoulder blade doesn't kick up. Their arm is going to be 90 degrees to their body, and their elbow is at 90 degrees. They're going to keep their wrist straight, and with their hand on their wrist or hand, they're going to push down on their arm, stretched out, of course, all the way down here. And this helps to stretch that posterior capsule, and which will help for patients to reach behind the back, because you have to be able to do this to be able to reach behind your back. And again, she'll do this to get to the point where it feels tight, hold it for 20 seconds, and do 2 sets of 20 seconds.